Hello, and welcome to the Order of St. Lazarus in Canada's video on palliative care in Canada. Dr. George Trussler is past hospitaller and Grand Prior Emeritus for the Order of St. Lazarus in Canada. He joined us to talk about the importance of palliative care.
Palliative care, a noble and true calling in today's world, a cause that has been adopted by the chivalrous Order of St. Lazarus as one of the pillars of their work. Palliative care is the special care of a person who recognizes they are at the end of life and who wishes to leave with dignity and compassion.
The world's first palliative care unit and program was established at the Royal Victoria Hospital in Montreal, Canada in the early 1970s. It was created by Dr. Balfour Mount, who perceived that there were many unmet needs with terminally ill patients and their families while care was being provided in traditional hospital settings. Since that time, palliative care has developed and grown to a point where it exists in a hospital setting or as a standalone residence in many communities across Canada and in the home.
Terminally ill patients may voluntarily enter palliative care. They recognize that normal medical interventions will not prolong their quality of life. They want no heroic measures such as resuscitation. Instead, pain management and comfort are the focus of care. In addition, all efforts to see to the well-being of the patient's caregivers and family are pursued.
Today, as much as 80% of terminally ill patients prefer to remain in their home if possible. Care can be provided outside established hospitals with the support of family as the primary caregivers, supported by organizations such as the VOM, a volunteer home care organization. Those patients who cannot remain at home may have access to palliative care departments at their local hospital or to an increasing number of standalone hospices devoted to patients at the end of life. While these programs are funded at least in part by federal or provincial grants, a significant amount of the financial and physical support has to be generated by the private sector and charitable fundraising to ensure a holistic program for persons at the end of life. The Order of St. Lazarus continues to support palliative care hospices and residences with its charitable funds.
The needs involved in the delivery of palliative care are so wide-ranging that every individual involved can achieve personal satisfaction in the support of this cause in some way or another.
There exists a real pressing need for private funding if all aspects of the holistic approach to palliative care are to be realized. What follows are some interesting examples of programs that have been undertaken by the commanderies of the Order across Canada. Dr. Robert Boyko is a member of the Western Ontario Commandery who is implementing a course for volunteers who provide respite to primary palliative caregivers in the home.
Our home caregiver support program was initially started by Tony Lee, who's the hospitaller for Western Ontario Commandery. He had a vision for this program to expand on the good work and information that was contained in a caregiver's guide, which was a very good document to start from that included a lot of the elements that are involved with hospice or palliative care in terms of education to family members. What I did was I made sure that I expanded the program content to include all four main areas that are traditionally associated with hospice or palliative care. That includes physical needs, emotional, psychological needs, social or information needs, and also spiritual needs that are often neglected in these type of programs. So the recipients of the training would be the home caregivers, and that would involve family, including the parents and siblings and partners of terminally ill patients, as well as close family members. Well, I think this program, the Home Caregiver Support Program, goes back to the roots of the Order of St. Lazarus, where the Crusader Knights actually provided hospice care to the pilgrims on their way to the Holy Land and within the Holy Land.
Chevalier Philip Russell is a former commander of the Toronto Commandery and has been a driving force behind the Toronto Hospice Project.
One of the problems that we face across the country, and particularly we do with the Toronto Commandery Hospice, is public awareness of hospice and palliative care. People need to know the difference. And palliative care used to be a model of doctors and hospitals with government funding. Hospices, residential hospices, were volunteer-driven. It was a community effort. Now, one of the things, ironically, that the Order has actually influenced has been bringing those two camps together. But our 10-bed hospice is going to mean a 43% increase in the number of residential hospice beds in Toronto. Still, that won't fill the need. There's a huge need for it. So a residential hospice, in fact, saves the system money, but it's a much better place for people, not only the individual dying, but their families.
The Hartree Bears are an initiative of the Western Ontario and Calgary Commanderies in memory of Reverend Canon David Hartree, who served as the Chaplain General of the Order for 13 years. These bears are given to patients or family members in hospices to help comfort them in their time of need. The late Carol McPherson of London, Ontario wrote, "What a wonderful surprise to receive the dear little Hartree bear. I take him everywhere, even to the doctor's office. It seems easier to bear bad news with the bear by my side." Dr. Paul Caffro, a physician at Slave Lake, says, "The symbolic nature of this toy has had a profound and uplifting impact on all families throughout this community." Darlene Holt wrote, "My Grammy is a star," to help explain her mother's passing to her two young boys. The Acadia Commandery, which encompasses Canada's 3 maritime provinces, decided to support the publication of the book for wider distribution. Now, Darlene says the feedback she has received from the book has been amazing. From Ellen Davies of the Hospice Palliative Care Association of PEI comes an example of some of that feedback. "My Grammy is a Star" was bought by a family friend and sent to Zurich, Switzerland to be read to twin 5-year-old girls after their PEI grandmother died of cancer at the age of 40. Now, the girls understand 4 languages and frequently ask their mother to read them the book from Canada. The ceiling in their bedroom is painted a dark color and covered in stars. Now, the twins have not been able to agree which star is their grandmother, but they've really enjoyed the book. Eva Villalba is the Manager of Product Development for the Palliative Home Care Society of Greater Montreal.
So the Montreal Commandery of the Order of St. Lazarus is funding a great new innovative project with the Palliative Home Care Society to create a training manual for volunteers specifically in the palliative home care setting. There are different factors such as the volunteer working without any supervision, the greater role of families in the caregiving unit, and things like that which are very unique to the palliative home care setting. By creating a training manual for volunteers in the home care setting, we can actually reach out to more people than we could if we were only dealing with our volunteers in our organization. So this partnership with the Order of St. Lazarus allows us to contribute to palliative care across Canada and not just in our own region.
The Ottawa Commandery offers a bursary for palliative care nursing students at Algonquin College.
Oh, there's been such benefits. The students that have struggled financially to stay in the program, they understand and are so thankful and grateful for the support that they've been given. And then when they go out in their careers, they're offering that kind of support to other people.
So my last 2 years was spending with a 91-year-old lady, and I saw how the nurses took care of her. They don't rush, they just spend time, talk with the family, talk with the nice lady that I have. And it's then that I realized that I have to do something about it, and I wanted to be that same person. I took them as a role model. There is a bursary that you can apply and for help if you needed money. When it arrived, it was just the time when I needed my book. I had an assignment with maternal caring, and I have to submit it the following week, and I don't have any money to buy the book. When that came, I was so happy. Here is the money, you can buy the book you want. So I was so happy. It was such a great help. I'm telling you, it was such a great help. This journey is not all about the person they needed help. It includes the family. They will be grieving too, and they're also in pain because it's their loved one, right? So that's how it is.
Our focus should be to help increase government involvement and private participation in ensuring adequate palliative care resources for our ever-aging population.
To me, the Order of St. Lazarus is a very relevant and pertinent organization because despite its lengthy history, it's actually invested itself in some very important projects by adapting its mission and contributing to our modern society.
Well, my understanding of the Order is that it's very much focused on those kinds of supports that people need.
The people behind St. Lazarus, they do a wonderful job. I can't express in words how to say thank you and how to let you know how I appreciate what you are doing, not just to me, but to the people who are your beneficiary. And I thank you for that. I really, from the bottom of my heart, I really do thank you.